Hi, my name is Heidi and I will be presenting the Health of the Global Workforce, a systematic bibliometric review as part of the Aston Newcastle collaboration on the behalf of our team, Adrian, Melia, Gary Fooks, Jonathan Tritter, and Francesco Paolucci. At the end of 2019, the number of international migrants was estimated to 272 million worldwide, representing 3.5% of the population globally. Half of them being workers, it represents a considerable global workforce. United Arab Emirates alone is composed of 90% expatriates. Other countries show substantial international migrant stocks, such as Singapore, 45%, Hong Kong, near 40%, or Australia, 28%. Although representing a crucial amount of the workforce, health of the global workers has attracted relatively little interest in comparison to other surrounding topics such as migrants' acculturation, adjustment, or other organizational outcomes. The literature has devoted important energy on the investigation of the most vulnerable, such as the refugees or illegal workers, leaving relatively under-researched the health of a much larger population. While often associated with low-status workers, migrants or expatriates are increasingly seen by host countries as a pool of talents, which is often let overeducated or overqualified and poorly supported by organizations to help them in the cultural adjustment process. Health of expatriates, for instance, has only been covered by a handful of articles. While the COVID-19 pandemic has been spreading worldwide in both developed and in developing countries, these reviews take the opportunity to raise questions in terms of health equity and access to global workers and their families. It aims to join the recent conversation on migrant health and respond to some of the multiple calls and warnings regarding the global health crisis and the expected increase of existing inequalities. Despite the large numbers of reviews available of migrant health, about 100 refugees and illegal migrants excluded, these tend to adopt a relatively narrow scope. Some focuses on particular conditions, some on particular populations, some again on specific countries or regions. Without diminishing their values, these reviews do not consolidate just yet the global workforce health as a standalone topic. Our review takes a different approach, first searching to better understand the health of the global workforce in times of a global pandemic. It adopts a more health economic and managerial perspective. Second, the aim of the study is to target a much broader scope of the literature on migrant and health in order to grasp its evolution structure and the main themes to propose a comprehensive picture of global workforce health. To do so, we conducted here a systematic and bibliometric review. Articles in the area of health economics and management were screened through Web of Science, searching for articles related to international workforce and health. Articles focusing on refugees, undocumented or illegal migrants were excluded as they are dealing with a more complex and specific issue. The final sample was composed of 1,658 articles. VoiceViewer was used as a software to support the analysis, and we complemented those by qualitative coding. Our review contributes to the literature in several ways. First, it brings a multidisciplinary perspective to the topic and helps bridging health with organizations, economics, and policies. Second, it consolidates the knowledge on global workforce health and intend to inform future research but also guide health policies worldwide. This is critical because the lack of knowledge of the health system in the host country and the language barriers would exclude even the highly qualified migrants in period of global health crisis as the one we are going through. Research on global workforce health has been burgeoning over the last decade. While the healthcare implication for the most vulnerable has been researched in many ways, including gender and race, the focus on the other, integrating a more dynamic but also economic and political perspective of the problem, taking into account special mobility of workers and talents, is a relatively novel phenomenon. It yet follows a larger trend of fashion and recent collective interest for social, sustainable, equitable, and ethical issues, interplaying with research ideas. To draw a concise picture of the state of knowledge on migrant health, we present a selection of 19 generic reviews on the topic. This overview grasps the overall knowledge gathered mostly over the last decade. Altogether, these reviews seems to show that the issues faced by migrants in terms of health are persistent over time and do not show strong progress overall. Taken 10 years apart, study will find that migrants are associated with higher occupational risk factors, more complex cultural, social, and economic background. Recent reviews still evidence that migrants work for lesser pay, longer hours, and more difficult working conditions, being more exposed to injuries, physical or chemical hazard, and fatalities that have been sometimes linked to higher risk of sick leaves or disability pensions. Higher language, communication, or interpretation barriers, or poorer knowledge of or understanding of the health system continue to appear the main obstacle to migrants' utilization of healthcare. Yet, narrowing the debate around the cultural aspect of the migration tend to hide other societal factors much more difficult to tackle. For instance, the discrimination has been found more prevalent among migrants than among their native counterparts in a very persistent manner. Another way to look at the literature is to examine the composition of the most cited articles. Some of the most influential research published. We observe that these mainstream publications are importantly biased, examining in their vast majority migrants and healthcare in America or Canada. This brings important limitations for several reasons. First, the American and Canadian healthcare is relatively different to many others in the world, and it represents a relatively particular case and grasps only partially the application for global workers' health as a whole. Second, the type of migrants in the United States and in Canada is also very different compared to migrants in Europe, in Asia, or in Middle East. We now turn to investigate what is the common ground of our extensive sample. Examining the co-citation in our selected sample, we aim to rebuild the structure of the field and unfold the 5 common underlying bodies of literature that we identified. Our typology of the literature is summarized as follows. First, the healthy migrant effect literature. It is a well-documented phenomenon that migrant health is relatively better than their local counterpart upon arrival. Yet, this advantage tends to decrease over time, some interpreting this as a convergence to the average national health. Others explain that while being young and healthy, and because of its important cost, migrants are less likely to contract health insurance, leading to a poor health over time. The theory expands to the Salmon bias hypothesis that explains migrants' apparent lower mortality risk by selective return migration of the weaker, sicker, and older. The stream of the literature has engendered debates and growing empirical testing to change existing paradigms, better investigate and identify health conditions, healthcare access, inadequate care, or underestimated mental health issues. The starting point has justified a number of research on the actual migrant health status and healthcare utilization, focusing mostly on social determinants, occupational health, and associated risk. That's the second stream. But also cause-specific mortality and the cost of health for migrants, the healthcare access, focusing on healthcare expenditure and quality, insurance and coverage, free access to care. It would be the third stream. As mentioned, migrant health is also associated to culture. An important stream of research oriented their investigation about migrants' acculturation, taking into account culture relatively broadly, for instance, adaptation, identity, or beliefs, but also discrimination, equity, gender, and other intersections. The last and related stream is migrant mental health, including depression, stress, social support, distress, trauma, coping, or psychological well-being as a whole, and which is very likely to grow in interest in the coming months during and after the pandemic and repeated lockdowns. Beyond the debate on the right to health that some countries recently reinitiated, with free access to COVID-19 care regardless of status and health coverage, the crisis has shown that global worker health is critical at the human level and for the economic sustainability. It revived the old equity debate and the right to health literature. Although universal, the right to health is often reserved to permanent residents. Yet, without going toward a moral debate, many advanced the reasons to protect migrant health, taking health as a global public good. Receiving nations and organizations have a role and a duty of care. Without proper health access for themselves and their relatives, educated migrants are less likely to commit, adjust, and perform. Less educated workers are not less important to the economy. COVID-19 has provided numerous examples of how migrants' health can impact society as a whole. From broken supply chains and empty supermarkets in America to migrants being frontline workers and critical actors in the management of the pandemic, thinking about the nurses, the drivers or cleaners, to name just a few. Our review also questions migrants' health and culture and the role of organizations. The vast majority of well-cited researchers focuses on non-Western migrants in Western countries. While these debates remain topical and important, it is leaving out a substantial account of migrants, such as self-initiated expatriates, constituting a much more complex population of Western and mixed background. This twist in the way we tend to stereotype migrants has notable implication. It adds to the pile of those challenged or refuted the image or assumption that migrants represent a disproportionate financial burden on healthcare system and society in general. Yet, culture and discrimination do play a role on migrant health access and utilization, but inequalities can only be explained by the individual cultural differences, and a more political standpoint needs to be taken to integrate, at the very least, the discrimination and marginalization layer underneath the perception, access, and utilization of healthcare by migrants. While the diversity debate is ubiquitous in management research, and while physical health, safety, and mental health is a trendy issue, health, as fundamental as it can be, remain left aside, considered as part of the private domain. Migrant health is virtually forgotten in management research, although being the convergence of all the sustainability, well-being, and diversity priorities classic in organizational discourse. At last, public policies play a crucial role in shaping how migrants adapt to life in the receiving countries. In particular, this has implications for health policies and to revive the associated political debate. It is about the policies to ensure that the migrant arrive healthy, but also how those policies do very little then to keep the migrants healthy once they arrive in the country. Altogether, we believe that this can help us to progress and to think about how to deal with the more global COVID-19 pandemic at the moment. Thank you for your attention.